Okay, so let's begin. So everyone can see my screen, right? I'll be sharing on the operating microscopes for this half an hour, and then the second half an hour, Izu will take over with his refraction portfolio. So for operating microscopes, we have 4 units in total for Topcon. Very simple, just 4. We have our higher end range, which is called OMS800, and within that range, there's 3. There's standard, pro, and office. And then we have our basic entry level unit, which is the OMS90. And that one would be very suitable for low budget or low cost low budget tenders, as well as for clinicians that are looking for a simple setup in their clinic setting, meaning not in an operating theater setting. So that will be OMS90, and OMS800 would be definitely suitable for all operating theaters. So these are the differences that are just flashed out before you. If you look at it simply, there are 3 under OMS800, standard, pro, and office, and they differ slightly. Okay, for our standard, they all look the same from the outside appearance, but they have minor differences. For standard, you are mainly targeting anterior segment surgery, and you do not have any ability to perform retroretinal surgery or look at the fundus. So that's one. The second is there's no electromagnetic locking, meaning you have to manually unscrew little knobs here and there in order to move the operating microscope arm, and you have to lock it by turning the knob to tighten it again. So that one would be not so convenient for most doctors nowadays. So standard is a rather basic unit, even though it can perform cataract surgery as well as any anterior segment surgery. When it comes to pro, you have the main difference is being able to have electromagnetic locking, which I think is a very convenient feature. With just a press of the button at the binocular's head, you are able to easily move the operating arm, because these are really heavy and bulky operating microscopes. Whereas cost focusing is allowing the surgeon to move the binocular head at a higher level of magnification, up and down usually, whereas fine focusing would be a bit more specific into tinier details to be seen. So between pro and standard, the main difference I would say is the electromagnetic locking and the cost focusing. Whereas for office is our top of the range operating microscope, and office can perform everything, all the way from anterior segment surgery to posterior segment surgery. And the only way you need to know how to differentiate it is with the term office, optical fiber free surgical system. So for our OMS800 range, standard is the you can say low, medium, and high. So standard is low, pro is medium, office is high. High meaning it can perform all the functions that a ophthalmologist would need if he's doing both cataract surgeries as well as retroretinal surgeries. Now, office and inverters go hand in hand, because when we look into the fundus, it is a concave surface. So automatically the image is inverted. Okay, just a basic optics that I think Izu touched on the last week. So when the image is inverted, you need a inverter in your operating microscope, and hence we have the inverter right here. The inverter right here, as well as the office. Office would mean it has a fundus viewing system. Okay, so office is a fundus viewing system. Inverter is to invert the fundus image to be the right side up. As surgeons are doing their surgery, it cannot be inverted. So office and inverter always go hand in hand. And the one thing that is present, the feature that's present in all three microscopes will be the three illumination modes, which I'll talk about later. Beam splitter, there's always a very standard option between 80-20, meaning 80% of light goes for the main surgeon's view and 20% for the assistant surgeon's view. And then the second option is usually 50-50. So the amount of light is split exactly into half for both main surgeon and assistant surgeon. But nowadays, with the sophistication of camera viewing systems or video recording systems, it is not a big deal whether you choose 80-20 or 50-50. Conventionally, people would choose 80-20 because we want to give the priority to the main surgeon, and 20% only goes to the assistant surgeon, but it's fine, whatever it is, because the camera systems are getting more and more enhanced. So we have Ikegami for Topcon. I'm not sure over there in Vietnam whether you guys choose Ikegami as the video recording system or something else. Okay, so when it comes to our three illumination modes, we are only talking about these. Very simple. We have different angles, basically, of the mirrors within the operating microscope to cast and refract the light in a different angle to create either a very good red reflex, that's very important for cataract surgery, or very good shadow contrast, which is also important for cataract surgery, or some kind of retro illumination for posterior surgeries. And then finally, we have our yellow filter, which is something that is present in most operating microscopes to prevent any phototoxicity. So the full illumination mode is very appreciated, especially when we talk about our OMS800 office, because we are saying that with our office system, we can allow surgeons to perform vitreoretinal surgery bimanually. Bimanually means both hands are engaged in the surgery. They do not require an additional hand to hold a light probe for illuminating deep within the eye during retina surgery. And that's because of the full illuminated mode, which allows more light to enter the eye. Plus and minus is generally for good red reflex, as I mentioned, for cataract surgery. So our foot switch here, it is customizable, whether you want the focus to be left, right, or vertically. Okay, so all these you will be able to familiarize as you as you demonstrate the operating microscope to doctors more and more. It's quite, this side will be for coarse focusing, the other side will be for illumination, then the on-off buttons, and then the micro movements for XY direction, meaning left, right, as well as the zooming and the focusing. Okay. So when we talk about red reflex here, we're always using the -2, +2 angle of light, just to show you optically how it looks here. Whereas, so many questions. Okay, we'll get to the questions a bit later. I'll just go through these slides first, yeah? No worries. Whereas shadow contrast is for full illumination, and that is where all three angles are engaged. As I mentioned, when doctor is performing vitreoretinal surgery, you usually want to use full illumination. Now, traditionally, cataract surgeries, even now, are performed very quickly. So most doctors actually don't really want to change out of the red reflex light or out of the full illumination light once they're in it, because they are so quick in performing the cataract surgery. But traditionally, usually if you look step by step, it is done this way: cortical aspiration, and then secondly, during phacoemulsification. These two steps are very important to use the red reflex light, which is the +2 -2. So your question earlier was on how many functions to No.
How do we count with the function? How many functions we can count with this switch? So,
How many functions we can count? Okay. Do you want to explain that question? Sorry. Was it think?
so he's asking
Thịnh ơi, Thịnh,
compare.
Thịnh ơi, ý em muốn hỏi là gì Thịnh? Ý em muốn hỏi là có bao nhiêu chức năng ở trong cái này hay là có bao nhiêu phím chức năng?
Em muốn hỏi là có bao nhiêu chức năng mình có thể đếm được trên cái bàn đạp anh? How
Là
many
phím
functions
chức năng.
we can count separate in this foot switch?
Tại vì là nếu mà phím chức năng thì nó sẽ khác là chức năng ấy Thịnh. Cái chức năng ví dụ zoom thì là một chức năng, nhưng mà phím chức năng thì nó sẽ có zoom in và zoom out là hai phím. Nên là mình cần làm rõ. Tức là ý em hỏi là có bao nhiêu button nữa đúng không?
Bao nhiêu phím chức năng à? Là zoom,
Tức là
zoom in là một, zoom out là một.
zoom in, zoom out là một. Thực ra em có thể đếm ở trên này nè. Trên này nó có đủ mà. Mình có thể đếm được mà.
Mà spare nó có tới 2-3 cái spare.
Spare.
Right.
So what was the meaning of the spare? Spare meaning that you can apply for the function, right?
Spare is the spare light bulb. No, we don't. Sorry, we don't usually use this button. Yeah,
But I
because
think
the
you can use some function with the spare. I think so. So you can program to use some function. Like
for
as the
standard
auxiliary, it may
maybe.
be for the second light source or something.
Well, the thing is, if there's a need to change the light source, usually it is manually done by just, pulling out the spare bulb and putting back in. So I need to find out from
So I think the question is because Pick joined some tender, and in the tender they also require the function of the foot switch. So how many functions they can control in the foot switch? For example, like you have the illumination on off, you have the illumination angle, you have the XY, you have the zoom in, you have the focus. You also have the inverter for the office, and also there are two spares, so we have to understand what it is. To put it into the tender, maybe we have some function, but the competitor they don't have. So we have some advantage during that.
Okay, yeah. The spare, I'm not very familiar with what the spare is because it's usually talking about standard. And for my side, most of the tenders that we join in, we usually go in with either the pro or the office. Yeah, so don't worry, let me find out on exactly what does this spare mean. Yeah, then I will get back to you just by replying through the Teams message that you that you asked.
Yeah, so we just want to make clear to join some tender configuration.
So my understanding of what Zeiss Lumera usually they usually showcase that their LED lighting is one option, whereas Topcon does not have LED lighting. We have halogen. But the second thing that Zeiss offers, one feature is the HA mode, meaning halogen mode. So they are using LED lighting, but they want to give a feature where they can mimic a halogen light bulb. So on that point, we usually would put in that, Topcon is existingly already a halogen light bulb. So there's no need for the halogen mode. And then thirdly, these are the main three differences that Zeiss always comes out with that is different from Topcon. And the third one would be the blue blocking filter. So when it comes to blue blocking filter, we don't really have very directly anything to counter that, but we do have a yellow filter.
From Suzuki-san explanation, filter doesn't works with for engine, so you don't do engine.
Yeah, so as Suzuki-san was sharing with us before, he asked and he said if you have the opportunity to ask why is a blue filter or blue blocking mode important in a operating microscope. So that was Suzuki-san's way of countering that point. Yeah. So I hope that helps you at least for this tender. Okay, I just want to point out again that when we are talking about OMS800 Office, we have electromagnetic locking, which is just situated conveniently at the surgeon's binocular tube, the handles right next to it. Okay, and how the inverter is activated automatically. So there's actually no need to manually activate the inverter. Once the office or the fundus viewing system head is pulled down, it is automatically inverted. So the image would be automatically inverted, and that is it's a good feature to mention. So secondly is the number of front lenses that we have. So we have 6 options here, and 40, 80, 120. So when it comes to Zeiss, they have their resight system, right? And their resight system is basically like our office system. It's used for the fundus viewing surgeries. So I think I have a slide on that. Their resight system uses only 2 lenses. There's only 2 options available. So on that point, we can say we have more lenses available. Yeah, compared to the resight one. So why do you need more lenses? So the option of more lenses give you this amount of field of view to focus on depending on the type of surgery that the surgeon wants to do. So the smaller diopters are suitable for very high magnification, very high specific zones, usually for macular zones. Whereas something that's a bit more mid-periphery, you can move to the 80 diopters. Whereas something that's way wider at the edges of the retina, then 120 would be more appreciated for those field of views. And the reason why we have small and large is generally for pediatric cases. Yeah, so there's one reason is pediatric cases, the size of the eye is pretty small, so the surgeon has a option to use a smaller diopter just for the ease of moving around their scalpels and their cutters. So again, we give more options for the surgeons, and all these lenses come in as a standard component when you order OMS800 Office. Okay. I just want to specially mention this lens, detachable anterior lens, and how it is only compatible with the 40D small lens. And the reason why it is worthy to mention is because it can quickly transition the surgeon's view from the fundus to the anterior. So in this case, when you pull this whole fundus viewing system down, the office system down, the surgeon is looking straight at the retina. So if there's any case where he or she is done with the fundus and wants to have a quick view on the cornea, the anterior segment, the surgeon just needs to put this anterior lens on top just nicely place it on top of this 40D lens, and you have a quick transition to the anterior view. Okay, so this is also another feature that we can share to our surgeons. Okay, the next thing I want to mention is about the assistant microscopes. So we do get quite a lot of queries on the assistant microscopes because there's, 1, 2, 3, 4, there's a fourth option also. So the 0° series here, we call it 0° series, is 3, 05, 04, 07, and they differ basically on the amount of tilt that they can have, meaning this binocular head, you can tilt it to the surgeon can tilt it to his or her, ergonomic viewing, comfortable viewing. And then we have the second category, which is the coaxial assistant binoculars. So mainly I will mention 07 and 02. So 07 is the most expensive assistant microscope. It pairs with any of the OMS800, and it's expensive because it has its own magnification dial as well as its own PD dial, and it has a lot of variability to move, meaning the tilt. There's a lot of movement it can do. So that's what makes the 07 the most expensive one, but it also provides the best stereoscopic vision, as I mentioned here. So, when you're choosing whichever configuration that you wish to provide for your customer, you can point out the advantage of the 07. 0° 07 is it gives good stereoscopic vision, and it can be easily switched and moved between the left and right of the operating microscope. So those are the two main advantages, even though it is more costly. Yeah. Now, this 07 can be used with the office also. I mean, for pro, for standard, for office, it can be used. But specifically, if you're doing fundus surgeries, if you want your main surgeon and your assistant surgeon to have the exact same mirror image of the fundus, then you need to mention that only coaxial assistant microscope can give the same exact fundus image. So if you're using a 0° on the 800 office and you're doing a fundus surgery, you would not get, meaning the main surgeon will get the inverted view of the fundus, but the assistant surgeon using the 07 would get a perpendicular view of the fundus. That is a very minor difference only. So either way, the main surgeon and the assistant surgeon can both see the fundus, just that a minor point to note is that it won't be exactly a mirrored image, unlike the coaxial. And the reason why that happens is just purely the location of the assistant microscope. 07 is located above the beam splitter, whereas coaxial is located below the beam splitter. So that angles the image slightly differently. The thing about coaxial is that, yes, it can give the exact same inverted image for both main surgeon and assistant surgeon, as well as the same laser filter. So I do know Alcon products are very smart in the way they design their laser filters, as well as their cataract aspirators, as well as their operating microscopes. And everything can be combined into one package, one unit to be easily bundled to be sold. But when it comes for Topcon, we have to be a bit more aware that if we are wanting to include or attach a laser device, a laser console to the operating microscope, and that means we need to put a laser filter onto the operating microscope, just be aware that the assistant coaxial, meaning the CT02 would be the most suitable assistant binoculars. So this one, if you are still not clear, don't worry, you can ask me anytime about it. at the time of need. Okay, so you did mention about the Zeiss Lumira series. They have 300 and there's 700. So 700, of course, is their top of the range, and undeniably it has way more sophisticated functions than 800 Office, because they are able to attach their a monitor as well as attach it to a OCT system. So all these are definitely going to bump the cost up way more. But when it comes to Topcon's unit, we are a bit more on par with the Zeiss Lumira 300. Yeah, 300 advanced. So that would be a more compatible product to talk about. So I was mentioning earlier, we have 6 front lenses when it comes to OMS Office. But for Zeiss Resight, they have only 2 60 diopters and 128 diopters. And the second thing is the way their fundus viewing system is designed is, I personally would say, not as streamlined, as clean as the fundus viewing system or the office system for Topcon. So another very keen competitor of ours would be the Takagi. I'm not sure if it's the same in the Vietnam market. Kong, would you have a competitor that mainly comes from Takagi or Zeiss over there?
You mean that for the segment of the research retina, right? For office or for
Yeah.
pro and standard? For office,
Yeah.
office
Both.
should be both. Okay, so for the high level, like for retina surgery, so I think the main competitor should from Zeiss. It should be there are 2. One is one is a Lumira 700 with design, and the second, the lower segment, should be the Lumira I with design.
Okay, all from
Yeah.
Zeiss lah.
Yeah.
Okay.
So, but there are some, they also use the Takagi with the biome. Yeah. There are some.
Yeah.
Yeah. But not much.
Not much. Okay, that's fine. Was just
for
curious.
the lower segments like OMS standard, so Takagi will be very strong because of the pricing and also the LED light source.
Okay,
Yes. And the original also from Japan. So I mean that most of doctor now, they try to move to LED because of the light bulb. It's a lasting longer, and the temperature is low. So even with I think the advantage of the OMS800 is halogen and the quality of the image. I mean that the reality, so the image look real, especially for the retina surgery. But now with the filter and with the new LED technology like Alcon now, they also have the LED with a very warm tone of the color. So they have 3 different temperature, and there are the one in the middle is look nearly the same with the halogen, and they have the advantage of the light bulb time, and also I mean that Topcon should think about at the LED light source. What I mean.
Thank you,
Because,
Kong.
yeah.
Thanks. Yeah. Thanks for sharing. I mean, even when we had the global trainer from Europe come over, she said, yeah, undeniably there's been no change to our operating microscopes. So it's not a lot to talk about, but we do have reliability.
Yeah.
Okay. Yep.
Can you come back a little bit, 1, 2 slides? So I think I have question for the sales team.
Which
The
one?
one
This
with
one?
the one with the assistant microscope. That one. Okay. Mọi người cái slide này anh nghĩ là khá là quan trọng, bởi vì là khi mà mọi người chọn cái kính hiển vi, cái kính phụ ấy cho khách hàng ấy, thì mọi người có hiểu được cái slide này không? Thì cái slide này khá là quan trọng đến cái liên quan đến cái việc chọn cấu hình ấy. Thịnh ơi, Thịnh có hiểu slide này không Thịnh?
Ở trên thì theo phân khúc giá hồi nãy Sen có nói thì con O7 là mắc nhất, thì mình có thể thấy rõ cái tính năng của nó cũng là nổi trội nhất là cái phần mình có thể gặp được là từ 45 đến 90 độ. Thì Sen có đề cập là để có thể mà hỗ trợ trong cái phần ừm, quan sát cái giống như phần dịch kính á, thì mình có thể dùng cái con O7 này để có được cái ảnh nổi tốt này, có thể dễ dàng chuyển đổi giữa giữa vị trí trái phải. Còn con 04 thì nó thuộc phân khúc thấp nhất, thì trong phân giá của mình á, thì nó sẽ fix ở góc 45 giống như cái của con OMS800 á. Còn cái mã CT202 này á, thì hình như mã mới hay gì á, em không nhớ có cái mã này trong phê giá nữa. Thì nó sẽ là kính phụ đồng trục, thì nó sẽ hỗ trợ trong cái việc mà dùng kết hợp với con laser quang đông chẳng hạn.
Đúng rồi. Anh có bổ sung một xíu thôi. Cái mà Thịnh nói là anh thấy là tương đối ổn rồi. Thì có bổ sung một xíu là cái 07 ấy, AM07 ấy, thì là nó dùng hai cái đường, nó có hai cái đường line, đường nguồn ánh sáng riêng ấy. Đấy là lý do nó không chia sáng với cái chính. Và nó lắp ở bên trái hoặc bên phải, nó bị fix nhá. Tức là mỗi lần là mình phải chuyển, ví dụ là bác sĩ mà dùng ở bên phải nhiều thì lắp bên trái, bên phải nhiều thì lắp bên phải, mà bên trái nhiều thì lắp bên trái. Cái điểm mạnh của con này thì Thịnh đã nói hết rồi, tức là nó có một cái view rất là tốt về hình nổi, và gần như là chất lượng cũng khá là tương đương. Nó hơi khác nhau một tí so với cái bên chính, bởi vì hai cái khoảng đặt là nó hơi khác nhau, vì nó hơi lệch một xíu, nhưng mà về chất lượng ảnh thì tương đối là ổn giống nhau. Nhưng mà cái điểm khác nhau của nó là nếu trong trường hợp bác sĩ mổ bán phần sau ấy, thì là nếu cái bộ đảo ảnh nó sẽ lắp vào cái kính chính. Đấy là lý do mà khi mà bác sĩ chuyển cái office xuống ấy, thì cái ảnh của bác sĩ sẽ được đảo ngược lại cái ảnh bác sĩ chính ấy. Còn cái kính này nó sẽ không đi qua cái đường line đấy, nên là nó sẽ không có bộ đảo ảnh. Thì để giải quyết vấn đề này ấy, một là mình chuyển sang cái kính phụ ở phía dưới ấy, cái CT02 ấy, và hai ấy là mình lắp thêm một bộ đảo ảnh cho nó trong cái kính phụ này. Thì lúc đấy mình sẽ phải mua thêm một bộ đảo ảnh cho nó nhé. Thì lưu ý là nếu như chọn cho bán phần sau thì phải để ý cái phương pháp này, cho cái vấn đề chọn này. Mặc dù nó tốt, nó hình ảnh nó đẹp, nhưng mà nó không bộ đảo ảnh và nó cũng không bộ lọc luôn. Trong trường mà dùng laser như cái ở dưới người ta có viết ấy, thì nó không có bộ lọc. Có nghĩa là gì? Bác sĩ chính thì có bộ lọc, còn bác sĩ phụ ấy, kính phụ là không bộ lọc. Như vậy thì nếu bác sĩ chính bắn laser là bác sĩ phụ có thể bị hỏng mắt. Đấy, nên là lưu ý là trong cái trường hợp mà dùng bán phần sau thì có thể là phải chọn cái mã là CT02 thì nó phù hợp hơn. Nhưng mà cái điểm yếu của CT02 sẽ là đồng trục thì sẽ bị chia sáng, nên là đấy sẽ là một cái điểm yếu của những cái kính đồng trục. Nhưng mà đồng trục thì nó sẽ nhìn mọi thứ giống hệt như bác sĩ chính, chỉ có điều là lượng ánh sáng khác nhau thôi. Chia sáng tức là gì? Sẽ là một bộ chia sáng 80-20, thì 80% cho bác sĩ chính và 20% cho bác sĩ phụ. Và chính vì là 20% cho bác sĩ phụ nên là hình ảnh bác sĩ phụ thì thường sẽ bị tối hơn. Thì mình hiểu hai cái option khác nhau với những cái ưu và nhược điểm của nó. Sorry, I just want to explain for them a little bit. So we can choose clearly for the configuration.
Yeah, understand. No worries, Call. Okay, so I will just move on. I just want to share a little bit about some new features that Topcon is in the works. New add-ons. Okay, new possible collaborations that Topcon may be that Topcon is working on. So as you know, our camera system is the conventional one, where we have a video recorder, we have a medical monitor. So when it comes to the latest features that is going around, even in Bosch and Lomb already appeared a couple years ago. They're having a 3D visualization system for surgery. So this is just one of the possible collaborators. It's a brand called iNovi from China. And over in our Topcon Beijing, they've already tried to pair this system with Topcon Office, OMS800 Office, and they are already rolling it out to their doctors and their surgeons to try it. And we are in the midst of receiving feedback. So there is such an option that we are moving to in the future where to keep ourselves on par with the other competitors that are offering a 3D visualization system. And that would mean, yes, you're wearing a goggle, right? You're wearing a 3D goggle so that the doctors can view and perform surgery. You know, these are more advanced and cutting edge methods that are coming up already. So just to share that with you, whenever we talk about 3D visualization systems, we're always talking about the latency, time latency, and that just means the lag, okay? Time lag, meaning from what you are viewing in your binoculars and what is appearing on the 3D monitor. There is always a time lag. And when we did a comparison, this is a journal here, they did a comparison for, no, not a comparison, but they did a study on how the time lag is for the Alcon Ingenuity system, 3D system versus the iNovi. iNovi is only about a 30 millisecond latency time lag, whereas Alcon Ingenuity has 80 milliseconds lag. So there is a difference there, and pricing also helps for iNovi. Okay, so I'm not sure maybe in Vietnam whether this might be something worth talking about yet, or maybe not so soon, but it's information for you guys. Okay, another collaboration which is already is the Vogue Merlin. So this is a option to upgrade the OMS800 Standard and Pro to be able to function as posterior segment surgeries. So besides just doing anterior segment, they can do posterior segment if they attach this Merlin system to the operating microscope. Of course, based on the feedback from our team over here, Izu and Shafiq, no, Izu tried out the Solar, which is their newer version of Merlin. It's the same thing, just a newer version. And the feedback is Solar is of course more superior to Merlin, just based on the viewing angle, because this condensing lens is slightly smaller in the Merlin, which causes a shadow or a ring cutting off the field of vision, whereas Solar is much more compatible with our field of vision. Okay, so just for your information again, that OMS800 Standard and Pro can be upgraded if you add on this attachment. Just a video to show you how it looks like. Sorry, all our ex-colleagues.
Where is he now?
Yeah.
Send him some regard from me.
Okay, sorry. Okay, yes, it's zooming in now. Okay, you can focus on
This one is a both Merlin, right? The Merlin one.
Yes, this is Merlin.
You can move both sides.
Yes.
Can rotate.
Sorry, yeah. Let me just.
But what
okay,
is
I should.
what you say is there are shadow, right, with the lens because the
Yeah.
lens
So
is too small.
here. This area. Correct.
Excellent.
The condensing lens area is a bit smaller. The Merlin is a bit smaller. The Solar is
Bigger.
better.
Mm.
So this
And
is
this one is
the
the
inverter.
inverter.
Yes, the inverter. This is the condensing lens, and this is the front lens, which they can rotate 360 degrees, which is a nice streamlined design.
Mhm.
So just to
So
share with you,
the inverter from both model is the same. I mean that with the solar and the Merlin is the same.
this one, yeah, the inverter will be the same. It is the difference of the condensing lens that we find
Mm.
more advantageous in the solar.
Okay, got it.
Yeah, all right. Okay, sorry, we took a bit more time. It's 2:45. Let me just stop sharing and Izu will take over here.
Thank you, Senwen.
Most welcome.
Hello, hi everyone.
Hi, Sue.
So I picking up where I left off before, but we are short on time. We'll try to finish what I can. I think I have to introduce this. This is like our breadwinner. This is like the main thing. If let's say you're promoting Topcon, our slit lamp is even very honestly is one of the best in the market. Okay. So this is only for people who just are not familiar with slit lamp. So I think the doctors can just have a nice, relax, have some drinks first. Let me just explain a little bit for people who don't have the background for slit lamp. So slit lamp is the workhorse. If let's say you're opening any eye clinic, you need a slit lamp. Doesn't matter what you're gonna do, at least the shop must have a slit lamp to do anything to check the eye. So this is the basis of ophthalmology eye clinic. So this is the history of slit lamps, started from Goldman. So you have the Zeiss type, and then you have the Hard Stripe type. So usually we sometimes say Hard Stripe is the tower type as well, but the small one usually will say the Zeiss type. Okay, so that's the progression of slit lamp from just a microscope. They put a slit together and then they combine everything. You get a slit lamp biomicroscopy. Okay, so the basis of slit lamp is to get a cross-sectional view. You want a cross-sectional view of the anterior. That's the primary reason why you need a slit to reduce the glare as well. And then with the auxiliary lens, something like VOP lens, 90D, you can actually see posterior as well. So it's a very flexible machine. For instruments, you can check the posterior, the anterior as well. So we fine tune a bit more with our slit lamp. So this is a basis of it. So we want a cross-sectional view of the eye. The main parts would be the anterior portion. So it's the easiest. We can cover a lot with the anterior. So this is just an example and something very light to just relax. We had a lot of facts before. So if we talk about cross-sectional, people who are not familiar with cross-sectional view, I take an example. I get a fish, and then if you want to see the inner parts of the fish, you cut the fish in half, something like this. Something like this. It becomes sushi. So that's where you see all the layers, all the muscle fibers, the fat layers as well. So that's the basis of it. So don't take it literally, but if you are still imagining how to get the cross-sectional view, it's basically like cutting the fish open. Okay, so slit lamp function, this is a few of functions that we can use it for. We can check the sclera, conjunctiva, the lids, cornea, anterior chamber, contact lens measurement and fitting, crystalline lens, the iris, the trabecular meshwork. You can check for
close angle glaucoma with the Van Herk technique. You can check the fundus. You can check meshwork with the gonium as well. You can use it with the laser. So there's a lot of function. So any basic eye clinic should have a very good, well-equipped slit lamp. Okay, that's the true example of a cross-sectional view of the slit lamp. So you can see on the left here. So this is the slit lamp view. And this is a diagram or to just show the figure. So when you have a cross-sectional light, it gives you a cross-sectional view of any transparent structure. So this is the lens, but you can also see the cross-sectional view of the cornea. So this is the usage of slit lamp. So this is why doctor wants a very good slit lamp to make sure they can do their work easily, comfortably as well. Okay, this is just an animation. I just want to show parts of the slit lamp. So this is the tower. This is a light source. This is all the light source you need to control the light source to become a slit. Or you want a circle shape. You want aperture change is all over here. So if let's say you want to control the camera unit, the binoculars, the PD adjustment, it's over here. So this is the binoculars. This is the camera unit, DC4. So I would always recommend if you are trying to push for a slit lamp, try to get our best slit lamp if possible. It definitely gave a lot of functions to the doctors and they would appreciate the Topcon slit lamp. Okay, so the base unit controls the camera. You can see a button there. But there are certain models. I think all the models over here, the new one, it's fine. But if let's say you find the D7 or older model slit lamp, the button is not there. You need an external button for the camera. And if you notice the bottom unit, it only have basically the power supply over here, and also the joystick with the camera button. So we make it as simple as possible to make sure they can maneuver with one hand. So you can adjust with your pinky finger for the light illumination. You can press the camera with the thumb button and the joystick move around. So we'll try to make it the easiest so you don't have a lot of buttons. You don't have to use both hands. Okay, so this is also not for doctors. This is just techniques that you can get from slit lamps. So usually you need a diffuser to get a diffuse illumination. You'll get the good overall picture of the eye anterior portion, and usually use it with a low magnification light source 45 degree to 30 degree. So this is the basis of it. If let's say you're using it with a DC4, you have to push it to the side slightly. You cannot put the slit light, the light source in the middle of the binoculars. It will block the camera. Okay, so direct illumination, we have parallelly pipette, we have optic section. So this is to check the layers of the lens, crystalline lens, and also the cornea. Then we have specular reflection. This is to check the endothelium. So it is possible to get endothelium with our camera as well. And if let's say you're promoting our slit lamp with the camera, please show this function. It's the easiest function to convince doctors. If you can do endothelium with a camera, that means it gives you one of the most detailed slit lamp possible. So I'm not saying other slit lamp cannot do this. You can, but this is one of the technique that once you do, you basically it's sold already. It's very strong technique. Once you show this, even the doctors do not really need it to be clear with the camera. They can use it with the binoculars only. But once you show this, it's possible to do with a camera. They would convince this is a very good camera and also slit lamp. So try to practice and get the endothelium. We always show it as a convincing power. So if let's say you want to check the structure
but
of
it's
the cornea,
difficult.
yeah.
It's difficult.
Yes, it is.
It's difficult. Yeah, we try already, but it's difficult.
Okay. I
We
can
need
share you a video of step by step how I do it.
Yeah, yeah.
And if you can, please do it. I would really recommend to get this skill sorted out. But once you get, definitely, you don't really have to say much about the slit lamp. People already inside their heart, oh, this is a very good slit lamp. Okay.
So yeah. So let me tell to the team a little
I'll
bit
try.
this
Yeah,
point.
I'll try to share the video. I did one
Yeah.
step by step. Other distributor wanted it, so I can share that.
Sorry, Izu, I just want to talk in Vietnamese a little bit for this
Okay,
point.
sure.
Yeah.
Mhm.
Mấy bạn mới nhá, thì các bạn đã được nhìn Izu chụp cái này hôm ở bên Hải Dương ấy. Thì mình sẽ nhờ Izu để Izu share cái tính năng, tức là các cái bước mà bạn ấy dùng để bạn ấy dùng cái DC4 bạn ấy chụp cái tế bào nội mô của bệnh nhân. Nhưng mà như Izu nói đấy, tức là nếu như mà các bạn làm được cái kỹ năng này nó hơi khó một xíu, nhưng mà nếu mà các bạn làm được ấy, thì các bạn đang chứng minh được hai thứ. Một là cái sinh hiển vi của mình ấy, cái hệ thống quang học nó rất là tốt, và thứ hai là chất lượng camera nó cực kỳ nét khi mà nó còn nhìn đến các cái lớp tế bào nội mô của giác mạc. Thì khi bác sĩ mà nhìn thấy cái hình ảnh này và các bạn làm được trên cái kính demo của mình á, hoặc là trên kính của bác sĩ, hoặc là trên kính demo của mình, hoặc là trong các hội nghị á, thì bác sĩ sẽ cảm thấy ta sẽ không cần phải nói nhiều nữa, bởi vì các bạn biết này là sinh hiển vi nó không có nhiều thứ để nói đấy. Nhưng mà nếu mà mình show được cái hình ảnh này, nó giống như là mình thể được đẳng cấp của cái sinh hiển vi ấy, thì mọi người sẽ cảm thấy rất là appreciate. Nên là các bạn lưu ý cái này và cố gắng tập để mà mình có thể làm được giống như là Izu đã làm nhé. Okay, thank you, Izu. So please share us the video step by step. We can take a picture
Sure.
of the
It's a very straightforward video with a little bit of help as well. So please try it. Okay. So sclerotic scatter, this is to check the integrity of the cornea. So it uses total internal reflection. Basically, you shine one side of the cornea and the light passes through the other side. So if the cornea have a demate like this, or it's still inside the wound healing phase, light would be scarcely at the other side. So this is a very powerful technique as well. So doctors usually use it. So if let's say they ask, at least you guys know. I just want to check something like this. They will ask, I just want to check whether the cornea structure is good or not. How do I do it with the slit lamp? So at least you have an idea how to actually do it. If you are not really confident, it's fine. You can ask me as well. Okay, so indirect illumination, this one you need to dilate the eye a little bit. So if you're not dilating, it's very, very hard to get, because it's a indirect reflection. It's a red reflex. So when you shine it, sometimes the pupil would react to the light and will constrict. So it becomes hard to see the reflex. So Van Herrick technique is one technique doctors use for to see whether it's a close angle glaucoma. So you basically see the shadows between the slit and also the part you can see there. So you can, let me just show this. Okay, so corneal section, this is the light source from the slit lamp. There's a scatter of the iris, so that means it's the margin of the gap between the cornea and also the iris. So this is the gap. So there's grading to it, whether it's the same as the slit, whether it's half or quarter. Okay. So you can do it for fundoscopy as well. There's a working distance to it. I'm not really that great with fundus because I don't really do it a lot. But you kind of need the auxiliary lens like 90D or 70-80 as well. So you can do it with a gonioscopy. You put it on the cornea, attach, and then with the lubrication as well. And then you can actually see the space in between the cornea, and also, so basically they want to see the trabecular meshwork from here. Okay, so this is our slit lamp. We have 6 variation: D2, D4, D3, 01, D701. Okay, so even though I say it here, even the brochure say it's a halogen type, D701 you can put both halogen and also LED. But just keep in mind, we will always recommend LED first before halogen, because the slit lamp is a custom-made LED. They customize the LED frequency to make sure it scatters more. So I'll explain later with the next couple of slides in the front. So this is a LED type. Okay, so this is key selling point for slit lamp. So as I said before, our light source is a custom-made light source. It's not your typical LED. So the frequency is a shorter frequency, so it is actually closer to blue light. So when you have a shorter frequency, it will scatters more on anterior portion of the image. So it's excellent anterior segment cross-sectional image. You can see better in terms of flares. You can see if let's say there's debris on the anterior chamber with our LED, it lights up better. So one good example is if let's say it's hard to imagine. So when in the morning, you see the light slightly bluish. And if you notice, in the morning, it's easier to see dust particles. And evening, it's actually a bit harder to see dust particle, because basically morning, evening, it should basically have the same light intensity, but because of the frequency, the color of the light, it scatters more, so it brights up. Okay, that's one key selling point. Very good, specialized for anterior segment. But even though our LED is specialized for anterior segment, we have the amber filter as well. So some model of our slit lamp doesn't have the amber filter, so keep that in mind when you get the LED. But most of them, not most, only 3 models have the amber filter. So when you see here, when you put in the filter, it will change the frequency of the LED to a more natural color of the fundus, which you can see here. So this is more natural. The problem when you have the anterior, it's specialized for LED for anterior. When you shine for fundus viewing, the fundus becomes a bit paler. So sometimes, especially older doctor who used to halogen, they will say it's not natural. The color is not natural. Okay, so you have the amber filter. This is basically explanation in terms of frequency. Our LED is the blue color line here. When you put in the blue filter, which is on top here, it will reduce the blue light and maximize the rest of the color frequency. So that's how they actually get a better fundus image. And then this is a special model. I think Vietnam also saw a couple of D701 FEG. So our slit lamp have a special frequency which excite fluorescent better. So compared to normal cobalt blue. So if let's say other slit lamp, they're using cobalt blue filter. So when you have cobalt blue, it does excite the fluorescent, which make the fluorescent change color to green, but it's not the maximum or close to maximum excitation period. Okay. So this is an example of the color. So when you have a laser which is green, and then this is just an example. When the light is blue, you can see both color. You can see the blue light, you can see the green color. So the FEG is basically a system. Once you buy FEG, you will get the barrier filter that is only for Topcon blue filter. So I cannot stress how important it is. The FAG barrier filter only match with our Topcon blue filter. It needs to be together. But if you have the cobalt blue, which is the normal D701, so if the normal if let's say not FEG unit, you have SLD701, you can actually put the yellow filter accessory to get the best fluorescent excited reflection. Okay, so this is just a graph. I know it's a bit messy, but it's a comparison. It's basically saying that our Topcon FEG have the closest excitant filter to the proper excited stage of the fluorescent. I know it's a bit confusing. It's more towards fluorescent reflection and excitation period. This is another example. So when you have the exciter filter, which is our Topcon blue filter, you shine it on the eye. If you don't have the barrier filter, it will show both blue and green color. But when you have the filter on, it will cover the blue light and only see green light. So this will maximize the fluorescent excitation. So why I'm stressing about this is any fluorescent images or fluorescent grading, dry eye grading, dry eye pattern, all need to follow the guideline. You have a couple of grading. You have Afron grading. You have Harvard grading system. There are a couple of grading system for fluorescent. So all of the grading system that is in the journals needs you to have a barrier filter together. If you are not using, that means you are not really following the guidelines grading system. So it's actually a point to point out to doctors as well. Why are you using slit lamp without the barrier filter when you do fluorescent? It actually doesn't follow the dry eye pattern or any dry eye or fluorescent patterns guideline grading system. Okay, so I'm just gonna stress that. Okay, another selling point, if you get a camera DC4, please get a background light as well. So BG5 is only available for D701. The other models use a different background light. But if you have a DC4, to really maximize the function and features, you need to have a BG5. So this is one example. You have image A here and image B. So for doctors or anyone with medical background or eye clinic background, they know what part of the eye the doctors is showing. But if let's say you get a camera, the reason you get a camera is to show to patients. Number two is for referral purposes. But most of the time, doctor get camera is to actually show to the patient. So if you show a patient with image A, patient don't understand what you're talking about. What are you pointing at? What are you showing? It doesn't look like an eye. But if you show it with a B image, you know the at least patient understand. Oh, this is at this part of the eye. Is it on the right, on the left, superior, nasal, temporal, inferior? So at least it gives meaning to the picture, especially for patient consultation. So this is another point. And over here is the mebomiography. Yes. So if let's say you have the BG5, you have the DC4, only you can get these features. So try to show this. Instead of just getting one dry eye machine, you can actually basically increase the feature of slit lamp and get one more features. So meibomiography, even though unfortunately we don't have the grading system for meibomiography software to actually get, but if you have this features, it put us, I would say, put us on top of standards as well. So the only camera that have meibomiography, sorry, the only slit lamp set that have meibomiography is only from MediWorks. So the other that you see on the internet, it's either from MediWorks, they change the name to Easy Law, for example, or they put in another module on top of the slit lamp. This one is a complete set. You don't have to put another module. It's just a bit bulky when you put in front of the slit lamp. Sometimes you have to take out certain component from the slit lamp. Okay, so it's a very good feature for tender. Okay, so this is the spec or the type of DC4. Sorry, the background light that you need to get. So it shows also which one is LED, which is halogen. Oh, sorry, SL2G is actually LED. Sorry about that. And the others is correct. So amber filter doesn't have on all. If you get 2G, doesn't have amber filter. If you get the D301, doesn't have amber filter. So please get, especially for hospital, try to get the best one. So D701 or D7FAG, 71FAG. Okay, so DC4, this is mostly about camera. So if you guys want to promote or trying to do demonstration for the patient, try to actually show a little bit about the DC4 because sometimes they want the picture to be clearer. So you can actually do a little bit of adjustment to make it better. So ISO is for sensitivity. Shutter speed is for the duration that you capture, the duration of light that capture on the image. Aperture size is fixed on the DC4. Okay, so this is the ISO. You can change it here. So higher definition, higher magnification, please increase the ISO. If you increase the shutter speed, for example, you need to pair it up with the ISO as well, or you can increase the intensity of the light, which doctor do not like to do. So try to just adjust the ISO instead. Sometimes I actually do setting on the preset here. So if let's say doctors want to see higher magnification optic section 1 nm on the cornea, just put here high magnification with higher ISO with higher shutter speed. So this is the default. So this is the BG5, which means the background light. So infrared is on the rightmost switch. So the step is make sure you put the switch on the infrared, put in the infrared filter, switch off the barrier filter. So this one should be on the left, this one should be on the right. And then switch the black and white mode, switch to black and white mode, which is here. Okay, already said this. Number 3, already said. Full illumination, turn off the slit. So you need to increase the intensity of the light on the joystick on the right, if you remember. And then you need to switch off the slit. So light is still on, but you are closing the slit. So there's no light coming off from the slit lamp. Please remember that. Then it's possible to get the meibomiography. So that's the step. So blue free filter. It will be a little bit confusing for some people because the exciter filter, which is the Topcon blue, is not here. Okay, this is actually on this part of the slit lamp. So usually if we talk about filter, all the filters should be here. But our slit lamp, if it's a DSL D701, there's nothing here. It should be this one. So 0 filter on the rightmost. If you see a B blue code color, that means it's a 701 FAG. So because the SL D701 FEG have 2 blue filters, the Topcon blue filter and also cobalt blue as well, both. So for a normal D701 FEG, the blue filter is on the aperture here. So you adjust from here. But if let's say the FEG, because I say there's 2 blue filter, this one, which is here, is the cobalt blue. Cobalt blue is here. Inside the aperture is the Topcon blue. Okay? Is anyone confused right now? Everything's okay? Okay?
Okay.
Okay. I know I'm saying this a lot, but there's a lot of question asking me back. Which one is the Topcon blue? Which one is the blue filter? Please remember, I will. Yeah, you can still ask me. I will not get mad, but I just would repeat this a lot of time because they would always ask me back. Which one is Topcon blue? Which one is cobalt blue? Okay. Later, when you have the model, FAG model, with with gigashas, please try it out just to make sure you're not confused. Okay. So how to actually do a fluorescent test. So it doesn't matter whether it's Topcon D701 or D701 FEG, flip the aperture to exciter filter or blue free filter, which is here. Then you can see blue color. And then make sure no other filter is turned on. Same thing. Very important for you to emphasize, doctors, please switch off any other filter, or before you start to do any slit lamp with patient, switch off all filter first. And then turn on the barrier filter, which is the second one. Then when you put in the fluorescent inside the eye, you would get the best contrast with the Topcon blue free system. Okay. That's only for slit lamp, but it's already 3:18. I have more. Do you guys want to put it in the future? Tomorrow? Tomorrow I cannot.
Oh.
Yeah, if from me, I still have KR, CT, Chronos, and software, and SP1P. So I can put it on the last day. I don't think I can. We'll try. Because software is not a lot. So how you guys? Are you okay with that? We're gonna extend because if I continue again, it's gonna be until 4 o'clock.
Yeah. So I think we can
Mhm.
extend, one by one. I think so.
Yeah. Is it okay?
There's
So I'll
not
just
too
take
much
more
in,
days
in,
later.
in one section. Yeah.
Yeah. There's a lot of details here because I actually just putting a little bit more focus on certain instrument because you guys are using these instruments and you're selling them a lot. So it's good